Hello everyone, thank you for taking the time to listen to our presentation. We will be discussing our telemedicine app design used for ambulatory care. For our team members, we have Max, Marilyn, and Mame, who all study at Kwame Nkrumah University of Science and Technology. And then myself, Emily, who studies at Worcester Polytechnic Institute, and Manan, who studies at Manipal Institute of Technology. Some may ask why a telemedicine app would be beneficial. Focusing on Africa as we did, there are very high patient-to-doctor ratios, making it hard for patients to be seen when needed. This app would allow better and constant access to healthcare, as patients can schedule appointments or even talk to a doctor through an immediate video consultation. This also limits the amount of patients in a doctor's office, which would also limit the spread of infection in the case of a pandemic. Another factor we want to focus on is an app like ours would give easy access to a patient's medical records, prescriptions, test results, and more, without them even scheduling an appointment, which also leaves the doctor available to see an actually sick patient.
Okay, so first we have the home page. We have the location of the patient. We have 4 tabs under the dashboard. The first one is for the hospital, for locating the nearest hospital. The second one is for the ambulance. You can get an ambulance like the way you'd order for a boat or an Uber. And then we have the COVID-19 tab for COVID-19 emergencies. We have the self-diagnosing tab, which helps you to diagnose yourself with symptoms, get to know what is wrong with you. And then we have the medical records of the person or the patient or whoever is using the app. You get to know the age and every other thing, medical records regarding the person.
And here we have the user profile page that summarizes all the users' information, their appointments, their orders you've made, with their tickets and all that, everything. So here is the doctors and hospitals page, which allows you to communicate with the health practitioners and providers. As you can see, the symptoms tab allows you to log in symptoms, and the app gives you suggestions to follow. If that's not enough, you can schedule a video meeting with the health practitioner, and if the need to go to the hospital, you can book an appointment with the doctor. And there are also features for lab tests and insurance.
Next page, we have the pharmacy. You get to order any kind of drugs you want, any product or medicine that has been prescribed by the doctor. You also get to see pharmacies close to you, your location. We have the cart app there where you get to order the product. And for the last page, we have the notification or the settings where the patient gets to modify how that would suit him or her, with the tone, reminder tone, and then the vibration, and then also in case you have to take some medicine at some particular time, the patient can just do it, or whoever is going to use the app can just modify it to fit them.
Now, one very interesting feature we paid particular attention to was the medical records, which most telemedicine apps lack. This will be like a single source for all patients' medical records, in terms of their allergies, blood types, the likes, and so medical practitioners or medical service providers can just access it instead of having to take tests each time the patient visits the hospital.